Hi everybody, I'm Pamela Atwood. I'm a gerontologist, a certified dementia practitioner, and a certified laughter leader. And I've been working with older adults professionally for more than 25 years. I'm happy to be bringing this service to you and hopefully provide a lot of information and education along the way about working with older adults. Today we're going to specifically work on information for people who are dealing with cognitive impairments, people with Alzheimer's disease and related disorders, which is my area of specialty. So I have so much that I want to share with you today. This actually came to me today because I was working with a client who started telling me some stories about experiences she'd been having with some of the staff on at the nursing home where she lived. So I wanted to share this with you, and I want to start by kind of giving us some ground rules. So first of all, understand that most older adults are not manipulative. I shouldn't say that. Most older people with Alzheimer's disease are not manipulative. However, if someone was very manipulative in the past, that can still linger. But the cognitive impairments usually get to the point where the person's frontal temporal lobes are so damaged that manipulation can be very difficult for them. So a lot of times, the reason I'm saying this is because so many times family members will say, well, I talk to my mother and it's like some days she can remember and some days she can't. And she's just trying to push my buttons. And I know sometimes it seems like that. But really, in all honesty, that is not pushing buttons. That is really just forgetfulness. And some of those behaviors are things that we need to work on through communication. So that's what we're going to focus on today, is how communication can manage some of these more challenging behaviors. I also want to say that a lot of times people aren't being stubborn, and I hear that a lot from families and from staff too. Just so you know, professional caregivers, we go through this as well. They say, well, she's just being stubborn, or, he said he would take a shower, but then he wouldn't. He's just being stubborn. We have to realize that how we approach things and the words that we use sometimes set up the older adult or the person with cognitive impairment to fail. So for instance, the example that my client was telling me today is when someone comes in and says, well, do you want to go to this activity? No, we don't ask, we tell. If someone with dementia still wants to refuse, they will refuse it. But if you come in and you say, do you want to? You're asking that individual all kinds of loaded questions, which means, do you know how to get there? Do you know how to get back? Do you know how to get there by yourself? Do you know how to be sociable? Are you going to be comfortable? Or have you ever been to that room? This particular resident is a relatively new resident. So one of the things that we need to work on is our approach. One of the things that I always share with families is it's like physical therapy. My husband is a physical therapist, and I'll tell you that if he ever walked into somebody's room and said, do you want to go to therapy? The answer would be no. I mean, we all know PT stands for pain and torture. There's just no way anybody's going to sign up for that, unless they get an ultrasound or a massage at the end. But that's probably not likely in this minute-to-minute hurry up, get the treatments done world. So physical therapists go in and they say, it's time for physical therapy, or gosh, we've got to get you down to the gym. It's time for your physical therapy. Imagine how things would be different if we walked in and said, it's time for time slips. It's time for art class. It's time for the movie. It's time for whatever. That person with dementia will still refuse if they don't want to go. But at least we've taken the cognitive part of decision making out of that. If their instinct is not to go, they're going to say no. Don't worry about that. It's not like we're taking choice away from them. We're still giving them choice, but we're eliminating the cognitive process that is challenging them, which then isolates them. So that's the benefit that we're trying to get at, is reducing that isolation. So approach is key. One of the things that I want to add on with that approach is to watch for body language. If someone is very distressed, and I always say, they pick up on our cues, we need to do a little bit better picking up on their cues. So a lot of times I'll train staff and I'll say, if somebody's walking around like this and they're very nervous and they're very upset, that's when you want to lead with a hug, because that's a person who's distressed. They need reassurance. They need to feel connected. On our dementia special care unit, we always lead with hugs. That's our frontline defense. Now, that's different than if someone's walking around with their hands clenched and they've got an angry face. Don't touch them. You're probably going to get punched. Those are the kinds of things we need to look at. We need to look at our approach in body language too. If I walk into somebody's room and say, Bruce is here to talk about the ESPN sports discussion for the residents. Did you want to go to that? Or It's time for the discussion. Let's go. I'm not going to go. That does not look engaging. Versus if I say, hey, guess what? We've got Bruce from ESPN here, and he's going to talk to us today about all of the latest information on the NFL, and we're going to finish putting together our fantasy teams today. Let's go. That's a totally different level of engagement that I'm going to expect. So it's much more likely that I'm going to try to engage with someone. The other thing is we need to be realistic about the environment. Now, as you know from these videos, I love telling stories. And part of why I do this is because I want to cut the learning curve. We as a family learned the hard way many years ago in taking care of my grandmother who had Alzheimer's disease. And one of the things that we learned is how to communicate with nursing home environments and assisted livings. And maybe I'll do a show on that coming up too, is how to communicate and how to express your knowledge of your loved one with someone who has, clinical routines that they have to follow and documentation they have to do. So we'll talk about that in the future, but I wanted to share this story when we're talking about communication in general. When my grandmother was, she must have been about 87 years old. At this point, she'd been living in the nursing home well over a year. They knew us, we knew them. They knew her. And at one point I get this phone call from the facility and they say, Pam, we have a problem. Your grandmother pulled the fire alarm. And I said, now I should tell you this also. This had been one of many silly calls that I had gotten. As a nursing home provider, these aren't really silly calls. You have to keep people updated. But to me it seemed silly because of the reaction that they were expecting maybe from me. So I said, I think you guys are doing a great job. And the person said, well, I don't think you understand, Mrs. Atwood. This is a very serious condition. I said, no, I know. I've worked in 5 nursing homes. I understand that every time someone pulls the fire alarm, 911 gets called automatically, and every time it's a false alarm, after so many times per month, you start to get billed. I get that. But you have a big red box on the wall, and it says pull. She read it, she comprehended it, and she followed directions. I think you're doing a great job. We have to look at, as caregivers, how much we're expecting of people when our environment is not necessarily dementia friendly or forgetfulness friendly. If we have a box on the wall that says Paul in big letters, someone with a cognitive impairment is going to see that and respond appropriately. Or not, but if they respond appropriately, they're going to pull it. How many other things are going on because of misinterpretation of the environment from what we know it in our cognitively functioning world versus an impairment in communication because of a dementia or a cognitive impairment. So that's one of the things that I wanted to share with you. Some tips is the next thing that I wanted to share with folks is how to kind of combat some of these communication problems. First of all, we want to do things in one-step directions. So if I say to you, come on to the bathroom and brush your teeth, that actually goes through 4 different parts of your brain. 1, you're talking to me and you want me to do something. 2, do I know how to do what it is you want me to do? 3, how do I get there? And 4, how do I do that activity? So first we want to do things one step at a time. Then if it's a complex task, we need to use what we call task breakdown. That means brushing the teeth. You're going to instruct that step by step by step. Maybe in one of these shows I'll demonstrate for you the way I do with our dementia classes here, how I teach that and how to really get into task breakdown because we think we're doing it, but we may not be doing it enough. The next thing is the next tip is to try to turn questions into answers. Now this kind of borders on what some people call validation. Validation therapy is something that I do believe in, and I do use it when we're trying to deal with the feelings and not the facts, and also to try to get people to remember that sometimes we need to join the metaphor, especially if it keeps the patient safe and the caregiver safe. So for instance, I don't like lying to my seniors, to my older adults, to my elders. But if it keeps them safe and me safe, I'm actually okay with a therapeutic fib. One of the things that we have to do, though, is kind of turn around and get to those feelings. For instance, if someone says to me, "Where is my mother?" In the olden days, we used to say, "Dear, you're 98. I don't think your mother's still alive." And of course, that re-traumatizes the person. They're saying, "What? When did my mother die? Is there going to be a funeral?" Now, they may not remember who you are or what you do, but they're never forgetting that you are the one who wouldn't let them go to their own mother's funeral. So that is not a conversation that we want to have. We do not want to re-traumatize someone. If someone's asking, "When is bingo?" fine, tell them when bingo is. That's not emotionally charged. But if it's emotionally charged, tread carefully. One of the things that I like to do is to try to turn that question or that answer into a question. So I don't know where their mother is not going to be a very good response. But if I say, you know what? It's almost 4 o'clock. Where do you think your mother might be? And then people with dementia really have this incredible ability to try to figure out where they are and what's going on around them. They will probably try to come up with an answer that makes sense to them. The trick with this strategy is you then have to do distraction and redirection. So going to the feeling, where does somebody ask where is their mother? When they don't feel safe and secure. Okay, I'm not sure where she is. Where do you think she might be? Oh, well, if she's at the market, why don't you stay with me until she gets back? I've got so much paperwork to do. Can you help me sort these? Tell me, you used to be a secretary. What is it doing? Where did you work? Oh, with the Travelers? Oh my gosh, it must have been so amazing with all those, whatever. Then you have a conversation and distract them into something else. One of the other strategies that I just wanted to share also was to anticipate needs. We need to remember that somebody with a cognitive impairment may not be able to tell us when they're in pain, when they're thirsty. They may not be able to know how to use a call bell. So we have to anticipate all their needs. If they're at home living in the community, we need to anticipate that too. If they have a cognitive impairment, the only thing we know is that it's going to get worse. So we need to anticipate those needs so that we can help them be successful as long as possible. So that's our show for today. I do have a quote, and let's see here. The quote of the day today actually is about learning from our experience. So this is actually a quote from Barry LePatner. Good judgment comes from experience, and experience usually comes from bad judgment. So, and then the other one I have here today is from an anonymous source. Experience teaches you to recognize a mistake even when you've made it again. I hope that all of your learning about dealing with older adults is positive and that you learn a lot on this show. You can also subscribe to this channel on YouTube. You can follow me on Instagram at pamela.atwood, and I'd love to have you visit our website, which is www.agingcareacademy.org. Thanks and have a great day.